Well, good morning, everyone. Thank you very much for coming, and welcome to our seminar. We have a story for you this morning, and very pleased indeed to have two L&D managers from NHS trusts in England. So this is predominantly a story about compliance, learning management systems, and the healthcare context. Taming compliance is the hook we're using here. I was considering wearing my tiger onesie, but I was, I think, sensibly dissuaded. But essentially, compliance is quite a wild, ravening beast in the public sector, as you know. All of the monitor, CQC, Ofsted type agencies are in there constantly updating regulations, and I think taming is an appropriate thing to think about. So we're talking about Totara Learn. We're sponsored by Totara Learn. Totara Learn is disrupting the learning management system marketplace. We're surrounded by some big players who are being challenged and looking quite thoughtfully at what is in effect a very affordable learning management system with Moodle under the hood. So we've got this interesting cocktail of a very configurable, customizable LMS, feature-rich and growing all the time. A sector in healthcare where people take compliance, regulation, and engaged learning very seriously. And this is one of the reasons we love to work in healthcare, because the practitioners are really serious about it. And then a partner like us, able to customize and make Totara Learn dance. So we also ran a survey with our healthcare clients, and we had responses from 12 organisations affecting around 80,000 learners. We had some really interesting metrics to share with you about how Totara Learn is taming compliance. This stuff's important because if you or a relative are in hospital, you need to be assured that your caregiver is trained. You know, knows about drug calculations, knows about the latest safeguarding requirements and so on. So it absolutely is critical stuff. We were delighted to be recognised by Totara Learning for best use of Totara this year to ensure compliance in the NHS context. And we're going to be sharing some of those findings with you as well. The context here, why healthcare is an exciting and precarious place to work, is that a third of nurses said in a survey last year they didn't have time to talk to patients and carers as much as they would like, to relieve pain, and to deliver the right medication because of the amount of work, red tape, and staffing issues that there are. So time is a critical factor in healthcare. There isn't any of it. And we know that the NHS is used as a political football in terms of funding. It's quite frightening, really. So with those pressures of time and budget, you've got huge constraints around how to create a great learning context. Now, getting into the nitty-gritty of taming compliance, you've got three elements: defining those requirements, getting the staff into an LMS, and in an engaged way, where they're taking essential pieces of learning away with them, and then reporting, tracking, and making it visible. And we'll rush through each of these. So, a survey response where that all of our healthcare clients said that Totara Learn had made it easier to target training to specific audiences, compared to some of the LMSs around here. I won't name any names, I'll get in trouble. But the NHS have license-free access to an Oracle LMS, license-free. So this is the context that we're working in as LMS partners and suppliers. The case has got to be made very strongly. Let's listen to Will from Taunton and Somerset NHS Trust talking about targeting.
So we found the creation of audiences to be an incredibly powerful and useful tool. Audiences are used to target staff, to tell them what training they need to do and how often they have to do it. To start with, that was quite a complex process, and that's by necessity in order to target the right people with the right training. We use lots of different profiles to target our staff, so where they work, what pay band they are, who their manager is, what directorate they fit within, if they're clinical, non-clinical. So audiences enable you to target all your different staff for the training that they need to do. It is a really powerful and flexible tool, so some courses are really complex. So the resource courses, it is quite hard to work out what staff need to do what courses. Audiences give us the flexibility and control to target those staff and let them find it really easy to get to the courses they need to do.
So it's that complexity that Will talked about there that makes this interesting, I think, because the key thing, I think, about solving compliance in a highly regulated industry is to hide or to mask the complexity. So there's an awful lot going on behind the scenes, but if you can present the learner and the manager with something that doesn't look complicated, then I think that's a huge win. So, a bit of boring detail for you here. The ability that Totara Learn has to create complex rule sets out of its audiences is what I think you'll be impressed with. So on the right here we have a role framework. This is actually created by Carl, who's going to talk to you in a second. And the ability to cite that a specialist practitioner role is patient-facing, is a registered status and clinical, means that you can apply that across your role framework and then quickly create complex audiences against combinations of roles. Similarly, the organisational department framework, what level of safeguarding is required, what level of resuscitation training, are administrative staff in contact with the public and therefore needing conflict resolution training. So really it's horrendously boring detail, but you need assurance that these interesting and quite random groups of individuals are being selected, plucked out from the wards, the departments, and targeted with the right level of training. So the next phase is about getting the staff compliant once you've told them the training they need. And at this point, we'll introduce Carl, please.
Thank you.
On we go.
Learning and development in a healthcare setting is entirely about improving quality and safety of patient care. That's entirely what we want to do. I am passionate about using education as the vehicle to setting and improving standards of care. The Totara Learning Management System enables users to easily access learning resources and classroom booking processes, along with many other functions. And it's that ease of use that has been absolutely key to our progress. Many legacy systems that organisations have historically used mean that they are cumbersome. You have to have a different login, and people often can't easily find out what their learning requirements are or access the resources. Our recent history is that in October 2013 we were placed in special measures by the Care Quality Commission, and one of the issues was that we had very low compliance, at that point around 83% across our topics. So in March 2015 I was commissioned to undertake a review of what was happening in the Trust, looking at policies, processes and the culture, and then put together a package of ideas and a plan as to how we could improve it. 3 months later that package was approved and I was commissioned to stay and actually carry on the work and really make the difference that we've made. And for a whole range of reasons, the Trust worked hugely hard across a whole range of issues, and in 2017, in July, we actually came out of special measures.
Should we attribute that to Totara Learn?
Yes.
Okay.
But it's about, our legacy systems weren't easy to access, and that many topics weren't completed, and it led to confusion. And it also meant that in our old TNA, which was stored on our intranet and not as part of our system, staff could actually talk to their manager and decide whether or not they wanted to actually undertake a topic. So although they were meant to have undertaken it, they could have a local derogation and then not receive that training. But we didn't know about that, and that was a real issue for us. So they had to log into one system to find out their needs. They logged into another one, to actually deliver and undertake learning, which really didn't work for us at all. So the new system we use uses our Active Directory. It makes logging in really easy, and therefore staff can get in anywhere they are at the time and see what they need to do, book a classroom or do their e-learning. Now, audiences are quite tricky to organise in a trust our size, but also we were talking to another stand earlier on, and we're saying that actually it is a little ecosystem. It's a mini part of society itself with a whole range and gamut of staff and experiences and needs. So we had to be really careful how we did that. So you can use your role profile and a subset of that. You can use the department or ward that they work in, and we do that quite a bit for very specific things. But as Matt showed you, we implemented the clinical, non-clinical mix, registered, unregistered, and patient-facing and non-patient-facing. And that has meant that I think the system is much easier to use and work, but at the back end of it, we can change those rules quickly, we can change the positions, so that when new people come into post, we don't need to think about what they're doing and where they're doing it. Actually, we just say, that's their role, and the system does it for us in seconds, really. And that means that before learners join the organisation, actually start working, they can start doing their e-learning from home and come along with quite a bit of their work already done. But it's meant that we can explain to staff much more easily their requirements. And as Matt says, we want to make a complex thing hidden in the background, and it very much is. Staff log in, they look at their essential training list, as we've called it, and they can see right in front of them what they need to do, what the refresher period is, and whether or not they're compliant, which is so much simpler. So the impact across the trust is that staff have this information at their fingertips 24 hours a day, wherever they are. And we went from 83% to 94% compliance within less than a year. So that was a phenomenal difference, just in numbers, but actually in the impact of staff actually doing the training they need to do, which clearly has improved patient care and safety. And we are looking at some metrics now to demonstrate that difference. So I would say that a system like Totara is absolutely ideal in setting those audiences and making it easy for staff to see what they want to do. So I thoroughly recommend it to you. And also I think we've had a great deal of support and engagement from Think as well to actually deliver this system. So thank you.
Well, that's excellent. Thank you, Carl. And actually what 94% means there is that the 3,500 clinicians and non-clinicians at Barking Havering Trust are compliant with 94% of their 20 or so topics across all the different regulatory frameworks and so on. So it's an extraordinary achievement. Thank you, Carl, very much. Another great response to the survey was that all of the surveyed organisations said that staff are more engaged with learning and development. So this thing of getting compliant is not necessarily glamorous, but it is important and it's highly valued when it's got right. So let's have a quick listen to Paul Norrish, Head of Digital down in Torbay in South Devon.
There's different ways to access. No longer do you need a computer to be sat at a desk. You've now got a choice around mobile, which is really exciting. We also wanted something around convenience. We're an NHS organisation that's very time pressured. So we needed people to be able to dip in and dip out when it suited them. We wanted a product that worked in harmony with the organisation, and that's around the shifts that people worked. We wanted a product that worked with the organisation. We've managed to spread our wings as well. We're now offering this solution on the back of us to our customers, those in care homes, those who are delivering health and care on our doorstep are now benefiting from this product. There's many NHS organisations just like us that are at the start of an adventure, and it's exciting because Totara has made that possible.
So far there are currently around 25 NHS trusts using Totara Learn, and in an increasingly competitive and sort of private sector influenced NHS, it's so important to try and generate these economies of scale, an ability for trusts to share and barter learning, knowledge and information. So we're working really hard to try and help that to happen. So in terms of user experience, just a quick idea of that with nice compliance blocks and dashboards on the homepage, giving you specific topics that you need to get compliant with, quick links into courses, and overall percentages or numbers of topics that you need to get compliant with. A typical course webpage in Totara Learn, where this blend of activities is allowing learners to select e-learning modules, resources, e-assessment, book on classroom sessions, and you've got great granular control over how these different learning activities interact, whether you're enforcing a learner journey or just giving them completely free choice. And Paul, that we saw down in Torbay, is got a recording studio in his hospital, and he's calling in the safeguarding lead, sitting her down, having a 10-minute interview with her, and dropping that video straight into the Totara course page so that learners can view it, think about safeguarding incidents in the context of their own hospital, and then completing a test, an e-assessment, using Totara's inbuilt quiz builder, and off they go, compliant. So making compliance real and sparking ideas that will lead to actual behaviour change. You know all that. There's far more eloquent men and women talking about that today, but it's lovely to be able to be a part of that with Totara Learn. Here from Paul again on blended learning.
Learning is like an iceberg. Too often, learning and development departments just focus on two things. They focus on classroom delivery and e-learning. But Totara Learning has opened up a world to us. We're now using video conferencing, we're bolted in podcasting, we're putting in video snippets for learning. The traditional route of A to Z is dead. Individuals want to explore. They want to experience a great and valuable learn. And we're looking towards the future as well. We're looking at live streaming our seminars, our classrooms, and also with live chat. So when our experts are online, they can be reached with simple, resolvable questions.
So the third element that's key to Taming compliance is making compliance visible to managers as well as to individuals, and organisational reporting as well. So we've configured Totara Learn and added in compliance reports and dashboards, and again, everybody responded to say that they find these useful. It's not just about compliance, there is a deeper, more important story behind it. Let's just briefly hear from Nick.
So compliance is very necessary in the National Health Service, but in itself is not sufficient. The NHS Constitution clearly states that the needs of the patient should come before the needs of the organisation. And compliance satisfies the needs of the organisation, but it's competent staff demonstrating their ability to work safely that satisfies the needs of the patient. We use the analogy red, amber, green, and it's a good analogy. But in the highway code, green doesn't just mean go, it means go if the way is safe. And for us to ensure that our staff are safe to practice, safe to look after patients, we want to ensure there's educational integrity with the training we provide, that it's not just click and turn. And that's what we're able to do with Totara, because the platform provides a breadth of options for us to create a true blend which ensures quality learning.
So that's a sobering thought, that as well as spending public money here, we also got patients at the heart of what happens. And it is a good motivator. It keeps us grounded and makes it a very serious matter. We've created some nice reports as well, based on pivoting data from within Totara Learn, making these clicks interactive and live, giving managers and administrators the opportunity to drill down through organisational structures to get to specific departments, identify hotspots, and then see individuals who need to be encouraged or nudged. So there's some good configuration and customisation opportunities here. And if you're interested in Totara Learn as a management system, talk to your partner about creating your own report sources, your own interactive report. It's easily done. You're not confined to a proprietary SaaS situation here. Take advantage of it. brief word from Will.
So we as an administrative function have full control over our reports now. We've created a number of different reports that are tailored for those who need the reports. So for example, our managers want to log on, they want to see their team, what training they've done, what training they need to do, when it expires, if they have or haven't done it yet. So the flexibility the reports give us enable us to meet all those different criteria. What I really like as someone who manages the reports is it's incredibly easy to make a change to a report or to create a new report. So if, for example, one manager has a really specific requirement or need, within minutes, pretty much, I can log on, set up their report and give them access to it. So the reports are really easy to set up, dynamic and pretty user-friendly for the staff that need to access them.
Delighted to have Ruth Thomas as well, Head of Training, Assistant Director of HR, together at NHS Trust. Thank you, Ruth.
So we've been using Totara for about 18 months now. Our compliance figures have increased, but actually I think the system has brought a much greater improvement for our trust. And that's a tangible shift in culture in terms of attitudes towards training and training compliance. Our previous system was complicated. Staff weren't always clear what training they were supposed to be doing. The system didn't always record training completion properly. And managers weren't always sure what it was that the data was telling them. We used to spend a lot of time downloading data, merging it with other information, reformatting it, and then uploading it onto our intranet so that managers could see it. But of course, by that time, it was already a couple of weeks out of date. And I used to spend a lot of time debating the figures with managers. I was regularly called into committee meetings to explain the figures to managers, to directors, to non-executive directors. And the figures were often questioned by the managers because they felt their training position was much better than the picture that was being painted. But because we didn't have real-time data, it was an argument that neither of us could win. And Totara has changed all that for us because the system does present easily understandable information in real time. When we first started working with Think Learning, we worked really hard to get reports that we felt our managers would be able to understand. We worked with them once we were implementing the system to help them understand what information was accessible to them. And we even checked some courses with the paper records that lots of them still insisted on keeping so that everyone was really confident that the data was accurate. And the difference that that's made for us has been startling. We no longer have frustrated debates about whether the information is right or not. And I haven't been called into a committee meeting for quite some time now. It feels to me like we're really working together now to concentrate on improving our trainers, not having arguments about whether the figures are right or not. And even better, managers now are seeing the data as their data, not some information that the training team has cooked up. Now they're starting to use the system and understanding the information. They keep coming to us and saying, what we'd really like now is this. Can you give us a report on this? And because the system is so easily configurable, most of the time we can say yes. So now we've got red, amber, green status reports, we've got team, locality, and overall percentage compliance reports, and a whole set of other information that managers are using to manage their team's training. And the same is true for staff more generally. My training team are spending far less time on the phone dealing with frustrated staff who can't find the training they need to do or have done it and then are taking a photograph to prove that they've actually completed it. And that, of course, is freeing up valuable clinical time for those staff. And what I thought I would do in terms of just finishing my section is show you an email that I received recently. I didn't canvass this, it just popped into my inbox. about our system that we call Learn Together. And I think this really speaks volumes.
It does, thank you very much. And it's a testament to your management and your vision too. So thank you. So there we are. Great to hear real life stories. Good news stories coming from the healthcare sector, from the NHS as well, about IT systems that are actually effective and working. What you've seen and heard today is quite a lot based in core Totara Learn and quite a lot customised, configured and written by us at Think Learning. So do bear in mind with Totara Learn that choice of partner is important. Look for a partner now that you can with domain expertise and knowledge, with plenty of development skill and experience. There's a great shopping pool of Totara Learn partners. It's a really exciting system. I would urge you to look hard at it.
We've also got some really exciting ideas about things we want to do with the platform. So whether that's new course ideas and how to target courses towards staff, or additional development to enhance the functions that learning and development can offer. And we're really looking forward to working with Think to make them happen, and also taking some of the ideas and the experience that they've got to offer to make an even better product for our learners.
So there it is. There is some time for questions or for comments if you want to ask our practitioners and our experts. But thank you for that whistle-stop tour of Taming compliance in the healthcare sector. Come and see us, say hello on stand H6 on the back wall there, and have a good rest of the show. Thank you.